It's a long wait to see a doctor at this diabetes centre on the outskirts of the Pakistani capital, Islamabad. It's the only one of its type in the country, and it's seen the number of people with the illness rise every year, many of them with little knowledge about the condition.
We are so busy at home with the children. We don't have time for ourselves. We don't take care of ourselves. The doctor told me not to eat too much sugar, bread or rice. I'll do what he said and hopefully I'll recover.
The World Health Organization says globally more than 420 million people have diabetes. It's the 8th biggest killer, resulting in 1.5 million deaths each year. The WHO says its rise is connected to the increasing rates of obesity and more people being overweight, and the trend is most apparent in low and middle income countries.
The numbers are rising at an alarming rate. At the moment we're ranked about 1 in every 10 persons in Pakistan is diabetic, but as we're moving on it might move up to 1 in every 4. So that means you can see at least one person in each family is affected by diabetes.
Wealthy countries such as Qatar are also seeing a steep rise in diabetes. Education programs like this one aimed at young people are stressing the importance of a healthy diet and exercise. Rich or poor, these startling figures in this report underline the fact that diabetes is now a truly global health issue, and one that will require dramatic changes to the way we live if current trends are to be halted.
There is no one answer that the WHO or any other organization can give to all the countries and tell them, listen, this is the recipe, just apply this, it's going to work. It's not. It needs loads of community discussions, involvement of community leaders, together with healthcare professionals and policymakers in order to come up with a solution.
Many countries are also struggling to pay for the increasing costs of new forms of the hormone insulin. These can be more effective than older drugs at treating diabetes, but they come at a price. In some cases, the cost of the drugs have doubled in the last 10 years. Back at the clinic in Pakistan, it's bad news for this elderly man. He was diagnosed with diabetes 3 years ago. Poor blood circulation as a result of the disease means he now risks losing his foot. The WHO says individuals and governments need to do more, and without drastic action, diabetes will continue what it describes as its unrelenting march. Tarek Bazley, Al Jazeera, Doha.